Hello everyone, let's learn about diabetes type 2. What is diabetes type 2? It is a long-term medical condition where the body does not make or use insulin properly, resulting in unusual increase in blood sugar levels. The body is not able to effectively use insulin to bring glucose into the cells. Firstly, let's learn about the factors and the causes of diabetes type 2. These are some of the factors and causes that will contribute to diabetes type 2. The first factor is genetic and family history. Diabetes type 2 can be inherited and higher risk with affected parent. Second, unhealthy eating lifestyle. High fat food, low fiber food, and fast food can lead to obesity and increase the risk of developing diabetes type 2 or even another disease. The third factor is inactive lifestyle. Physical activity helps you control your weight, uses up glucose as energy, and makes your cells more sensitive to insulin. Those involved in any physical activity have higher risk to get diabetes type 2. Some examples of physical activities are swimming and cycling. Next factor is overweight. Overweight is caused from unhealthy lifestyle and also lack of exercise. It is also can cause insulin resistance, so the insulins will not be used properly. Overweight people also have much higher risk of developing diabetes type 2. The fifth factor is age. The risk of diabetes type 2 increases as you get older, especially after the age of 45. That's probably because people tend to exercise less, lose muscle mass, as well as gain weight. The last factor is gender. Diabetes type 2 is more common in males rather than females, especially at ages of 25 to 54. Men are twice as likely to develop diabetes, and also men whose low testosterone level are at higher risk. Moving on to example of real cases. According to NHMS in 2019, in 2011, 11.2% cases has been reported, followed by in 2015, 13.4% cases, and lastly in 2019, 18.3% cases has been reported, and the trend of those years is keep increasing. Next, these are some of the news related to diabetes in Malaysia. Now, let's learn about the signs and the symptoms of diabetes type 2. Do you know that the symptoms often develop slowly? In fact, you can be living with diabetes type 2 for years and not know it. The symptoms included increased thirst and frequent urination. These two are common diabetes signs and symptoms. This is due to excess glucose builds up in blood, and kidneys are forced to work overtime. So when kidneys cannot keep up, the excess glucose is excreted into urine, dragging along fluids from tissues. Next is unintended weight loss. Insufficient insulin prevents the body from getting glucose from the blood into the body cells to use as energy. The body starts burning fat and muscle for energy. The third symptom is slow healing sores. High levels of blood glucose can lead to poor blood flow and impair the body's natural healing process. Furthermore, increased hunger. Diabetes may keep the glucose from the food from reaching cells. Other than that, symptoms of diabetes type 2 is fatigue. High blood glucose impairs the body's ability to use glucose for energy needs. Dehydration from increased urination also can leave patient feeling fatigue. Lastly are tingling in the hands or feet. Too much of glucose in blood can affect the function of nerves, burning pain in arms, hands, legs, and feet. For blood vision, high levels of blood glucose pull fluid from tissues, including the lenses of eyes. Left untreated diabetes can cause new blood vessels to form in retina and damage established vessels. For most people, these early changes don't cause vision problems. If these changes progress undetected, they can lead to vision loss and blindness. If you notice any possible diabetes signs or symptoms, contact your doctor. Diabetes is a serious condition, and the earlier it's diagnosed, the sooner treatment can begin. With your active participation and support of your health care team, you can manage diabetes and enjoy the active, healthy life. Now, let's look for the diagnosis of diabetes type 2. Diabetes type 2 is usually diagnosed using glycated hemoglobin A1C test. Below 5.7% is normal, below 6.4% is pre-diabetes, and 6.5% or higher indicates diabetes. Now, let's move to the treatment of diabetes type 2. Management of diabetes type 2 includes healthy eating, regular exercise, weight loss, blood sugar monitoring, and diabetes medication or insulin therapy. The first one is healthy eating. It is important to have a regular schedule for meals, smaller portion sizes, more fiber foods such as fruits, vegetables and whole grains, and moderate servings of low-fat dairy, low-fat meats and fish. Second is regular exercise. Exercise is important for losing weight and also helps with regulating blood sugar levels. Choose an aerobic exercise that you enjoy, such as walking and running. Resistance exercise increases your strength, balance and ability. Resistance training includes weightlifting and yoga. Third, weight loss results in better control of blood sugar levels, blood pressure and cholesterol. The more weight you lose, the greater the benefit for health and disease management. Fourth is monitoring blood sugar level. It can be done by using blood glucose meter. Measures the amount of sugar in a drop of your blood. Check it once a day and before and after exercise. Next is diabetes medication. In some cases, lifestyle changes are enough to keep diabetes type 2 under control. If not, there are several medications that may help like metformin, sulfonylureas, meglitinides, and thiazolidines dienes. Lastly is insulin therapy. It is taken by injection. Insulin type, dosage and schedule may change based on someone's blood sugar level. These are some of the references that we use in our video, prepared by the members of our groups. Thank you for watching.